Hey everyone, and welcome back to The Explainer. Today, we're throwing on our detective hats to crack a really complex medical code, cerebellar ataxia. We're going to dive right into the hidden wiring of the human brain to explore exactly how neurologists diagnose, investigate, and ultimately treat this incredibly debilitating condition. Let's get into it.
So, I want you to imagine, just for a second, suddenly losing the ability to judge distances when you're just reaching for a normal cup of coffee, or finding that you literally can't walk in a straight line without stumbling. It's kind of like a master conductor suddenly losing the beat, throwing the entire orchestra of your body's movements completely out of sync. For someone experiencing cerebellar ataxia, that's not just a thought experiment, it's their daily reality.
Now, the crucial thing to understand here is that cerebellar ataxia isn't actually a single disease. It's more of a category. It's a specific syndrome of neurological breakdown, marked by staggering, severe imbalance, and a total loss of coordination, all stemming from dysfunction in the cerebellum. And the triggers? They're vast, ranging from hidden toxins to deep-seated genetic mutations.
All right, let's move right into Section 1, the scene of the crime, and how we actually spot these core symptoms. When we're looking at the cerebellum, location is absolutely everything. The cerebellum is split into different functional zones. If a patient has damage to the midline structures, it essentially destroys their core balance, causing the trunk to sway and triggering irregular, jerky eye movements called nystagmus. But if the damage hits the outer hemispheric regions, that's what ruins the coordinated, targeted movements of your arms and legs on that specific side of the body.
So what does this actually look like during a clinical exam? Well, doctors are hunting for undeniable evidence. They might see dysmetria. That's when a patient tries to touch their nose and completely misses the mark. Or dysdiadokinesia, which is a big word for the inability to do rapid alternating movements, like quickly flipping your hands back and forth. They'll also listen closely for fluctuating, slurred speech known as ataxic dysarthria, and look for those erratic eye twitches.
Which brings us to Section 2. When solving this mystery, the primary clue is always the speed of onset.
In neurology, time is literally everything. If the ataxia hits someone out of nowhere, in mere minutes to hours, we're looking at an acute vascular emergency. If it builds over a few days to weeks, it's subacute, and we immediately start suspecting infections, autoimmune issues, or even hidden cancers. And if it's a slow, relentless progression over months or years, that's chronic, and that's when we start hunting down genetic mutations or degenerative culprits.
Let's talk about the acute cases first, because those are high-stakes emergencies. This rapid-fire onset is usually driven by a cerebellar stroke, sudden bleeding in the brain, or a massive dose of toxins. This means you need immediate emergency neuroimaging, like a CT scan or an MRI, to check for tissue swelling. Because if that swelling compresses the brainstem, it's life-threatening. You absolutely have to rule this out before doing anything else.
Once we've established the timeline, we enter Section 3, the forensics, or the diagnostic detective work.
Let's look at some physical evidence. An MRI, both with and without contrast, is an absolute must-have in these cases. If you look at the scans here, an MRI can reveal incredibly specific degenerative patterns over time. Notice the characteristic cerebellar atrophy. You're looking at a literal, physical shrinking of the cerebellar tissue.
But hey, before we go chasing after rare, one-in-a-million diseases, our medical detectives have to rule out the usual suspects. Honestly, you'd be surprised how often ataxia is just caused by toxic exposures. Chronic, excessive alcohol ingestion actively degenerates the cerebellum. We also have to scour the patient's medication list. Common anti-seizure meds like phenytoin in high doses or certain heavy-duty chemotherapy drugs can actually poison the cerebellum and trigger the exact symptoms we're talking about.
On the flip side, when the progression has taken years, we pivot to mapping out genetic suspects. We separate them into dominantly inherited conditions, like the spinocerebellar ataxias, where you only need one mutated gene, and recessive ones. Friedreich's ataxia is a prime example here. It's actually the most common hereditary form we see in the clinic.
Now, if the ataxia showed up subacutely, meaning over a few days or weeks, the whole investigation changes. Now we're hunting for inflammatory immune responses like MS or even a severe gluten sensitivity known as celiac ataxia. We also have to look for hidden tumors. There's a condition called paraneoplastic cerebellar degeneration, where the body's immune system tries to fight off a cancer but accidentally attacks the cerebellum instead. Crazy, right? We'd also check for severe vitamin E or B1 deficiencies, which can literally starve the brain's pathways.
All right, let's wrap this up with Section 4, closing the case and exploring management and treatment.
So here's the reality.
The initial treatment strategy is 100% dictated by the diagnosis. There's no one-size-fits-all magic pill. You might just withdraw a toxic medication and watch the symptoms reverse. For celiac ataxia, you'd enforce a strict, lifelong gluten-free diet. If an autoimmune condition is driving it, doctors might bring out the big guns, like intravenous immunoglobulins or high-dose steroids to quiet the immune system. And if a tumor is the root cause, treating that cancer becomes priority number one.
But what happens when the damage is already done? Across pretty much all forms of ataxia, whether it's genetic, acquired, whatever, rehabilitation is absolutely vital. Structured therapeutic exercises, alongside physical, speech, and swallowing therapy, are hands down the most reliable tools we have to reduce the severity of symptoms. It literally helps patients retrain their brains, fix their balance, and take back their independence.
On the medication front, while we don't have a total cure, clinical trials are giving us some really solid tools. Drugs like riluzole have shown in some studies that they can significantly reduce overall ataxia symptom scores across a bunch of different causes. Meanwhile, a medication like acetazolamide is incredibly useful for treating very specific genetic variants, especially the episodic types of ataxia, where the symptoms kind of come and go.
So, tying it all together, yes, the brain might suffer some permanent damage, but patients are absolutely not without hope. Through really meticulous medical detective work, highly targeted therapies, and a lot of dedicated rehabilitation, people can reclaim a huge portion of their mobility and their daily lives.
And that really leaves us looking toward the future. Think about it. With genetic panels expanding literally every single day and whole exome sequencing becoming more accessible to everyday people, we have to wonder, what previously unsolvable neurological cases are just sitting out there right now waiting for a precise diagnosis and ultimately a cure? Thanks for joining me on this explainer. I'll see you next time.